In my previous position as the director of the Erie County Department of Health in Pennsylvania, I was overall responsible for the accreditation process. Accreditation had just been announced in 2011, in September of 2011, and by November of 2011, we as a management group decided that we were going to apply for accreditation. We took a year process to become ready for accreditation and submitted our credentials, much like we're doing here. The strategic plan is our roadmap of how we're going to get from where we currently are to some future point. The strategic plan includes our vision for what the health district is, our objectives for what's going to make us be able to achieve our vision, and also how we're going to be able to do that. The strategic plan will be used in every single employee understanding what we are, who we serve, and how their job ensures the achievement of our goals as an organization. During the course of the development of the strategic plan, we look at many factors. What our strengths, weaknesses, opportunities, and threats are as an organization, and how that organization fits within the community. With that information, and with the information that we know about what it is that we are lacking either in resources or in delivery systems, we'll put together a plan, that strategic plan, that will guide us in delivering services throughout the next 3 to 5 years. Accreditation is going to accomplish several things for us. Number one is that it gives a standard framework for us to operate in that is comparable on a national basis. Any public health agency that's been accredited goes through a standard set of criteria so that we can compare ourselves from one organization to another. Secondly, it gives us the ability to be able to use tools and practices that have been used in other organizations to make them successful and that have demonstrated their ability, once applied, to be able to improve the health status of the community that they serve. A second thing that's very important for accreditation is that accreditation was actually sponsored originally by the funding agencies that we receive so much of our funding from, at the federal level, at the state level, and from various foundations throughout the country. The importance of having accreditation is that more and more health departments throughout the United States become accredited. Those funding agencies are going to require that an agency be accredited so that funding will flow through that agency. If we don't have accreditation, there will be certain types of funding that we definitely will not be able to receive. I'm very encouraged by what I'm seeing in regards to accreditation within the district. First of all, from the standpoint that we have significant involvement of many staff throughout the district, and that actually starts with the board. The board, during initial discussions with Dr. Iser as he was hired, asked about becoming accredited. The second thing is that through the leadership team, each of the members have fully bought into the need and the value of accreditation. And then as we've begun working with the employees and staff through the A-team and through our various committees and subcommittees, the employees who have become involved see the value of accreditation. And then beyond that, since we've begun involving other organizations and individuals from the community, they very much see the value that accreditation brings to us. One of the things that accreditation brings is change. Accreditation standards continuously change. And if there's one thing that we know in this world is that change is the constant that pervades everything that we do, whether it be as an organization, as an individual, as a country, that change is constantly with us. And one of the things that I'm very excited to see is that we as an organization are coming to accept change and recognize that change is necessary to be able to go into the future.